This is how I use one box of tissue for, like, usually with within a week. That would be very normal because I just keep grabbing them and towards my nose. Okay, the next chief complaint case that it's a very long one. So it's the main complaint is about depression. And so 10 days ago, this is a female who's 28, about same normal to my age. I'm So 10 days ago, the patient had a quarrel, after which she was unable to calm down. That evening, she experienced fullness in the chest, felt sick, and vomited. Then she went immediately to an emergency clinic. Examinations showed that her blood pressure and cardiac rhythm to be normal. The lab findings were also within normal limits, and she was admitted for overnight observation after taking the Valium and vitamin B complex, and the patient slept peacefully. And next morning, she still experienced fullness in the chest and complained of dull pain in the ribs. The nausea and vomiting became worse, and she threw up immediately after eating and drinking or taking medicine. Fluid was given by intravenous by IV drops, and the condition, however, did not improve. Patient was transferred to the acupuncture department. Physical examinations shows slightly pale with a pain and grooming expression. What is grooming expression? um, so the patient had vomited clear fluid, and there was no desire for food or drink. Bowel movement and urination were essentially normal. The tongue is pink with a white coating, and the pulse is wiry. The blood pressure is 130/80, and neurological examination showed no abnormalities abnormalities abnormalities. Yeah, I really got my fork this morning. And the patient had no prior history of significant psychopathology. Psycho, psychopathology. Oh my god, look at me doing all some big words. Anyway, so this is probably very, very common symptoms in today's world. I mean, I would say I'm definitely, in a worse condition, but I just don't throw up because, you deal with it. It's not like, if I don't throw up, I'm not sick or I'm not depressed. Everybody has a little bit of depression themselves. I'm sorry, I know this lighting thing is still not working very well for me, but it's already been a lot better than before. So oh my god, what is the diagnosis for this case? Okay, so this case is liver T stagnation. Wow, I thought it would be a lot worse than liver T stagnation because there's no symptoms when there's no what do you call the masses or blood stasis. It's because it's liver T stagnation. So the patient is quite weak. That's why the doctors only used 3 points. I remember this one: stomach 36, 220, and liver 3 for her for 30-minute sessions. It did not work, and so the doctor has to add 2 more points, which is PC6 and spleen 6 to nourish in, and this time it worked. And then the doctor went back to the 3-point treatment, just stomach 36 on the lower leg and 220 on the top of the head, and then liver 3 on the dorsal side of the foot. But it did not work again. And then the doctor has to go back and add them 2 more points, which is PC6 and spleen 6. So some people, when they're really, really weak, You don't want to put a lot of needles in them because needles takes away qi, and when she's already qi deficient, is deficient, and also stagnated. You need the qi to move the qi, so you don't want to take too much away from them. Thank you.